So let's go back to the map. Last week I announced our public health advisory system. Our public health advisory system uses a variety of data indicators to help us identify where the spread is increasing. Our experts believe that there's spread no matter what county you live in. It's just a question of how fast the spread is occurring and how much the spread is taking place. Currently, Ohio has 7 counties that triggered a red level 3 public health emergency. And you can see the counties, again, Hamilton County, Butler County, Montgomery County, then into Franklin County. We've got Huron County, Trumbull County, and Cuyahoga County. Franklin County, as I said, is on our watch list. That's close to becoming a purple level 4 public health emergency alert, which is the highest level. Yesterday I spoke to the health commissioners in all of those 7 red counties. Some counties have 2 health departments, one in the city and one in the county. And I spoke, I believe, to every one of them. I asked them why we were seeing the spread and what their opinion was, what the data that they were seeing at the local level was. They told me pretty much the following. It's spreading at large family gatherings, birthday parties, graduation celebrations, funerals. One of the local health commissioners told me that he is seeing in their county a lot of times the same names, which would indicate to him this arises out of a family unit, or maybe family gathering of some sort. They also told me that in some cases it is spreading in the workplace, some tourist destinations, and in churches. One health commissioner told me about, tragically, how a pastor and his wife both had it, and then it spread from there. In Huron County, which is current in the red level in Huron County, one of the things as we looked at the data and got deeper into it, we did see initially spread in the non-Hispanic community, then it moved into the Hispanic community. But one of the things that we saw there as we talked to the commissioner is that 7 out of 10 current cases are in the non-Hispanic community. So they believe it's quite widespread, not just in Willard, but throughout the county. Let me just say these health departments are doing a very, very good job under some very, very difficult circumstances. Today, after talking to the health commissioners, after spending the weekend looking at some of this data, I am announcing that the Ohio Department of Health will be issuing an order that will be effective at 6 p.m. Tomorrow night. It will impact 7 of our counties. It will impact all 7 of the red counties in the state of Ohio. And that is, the order is that it will be necessary for individuals who are out in public to wear a mask. Primarily, this will be when they are in a public place inside, a restaurant, a bar, jewelry store, some other place in public. This will stay on this order will stay on as long as that county is at a red level or a purple level. We certainly hope that these counties will drop out of that level, and if they do, our current order says that then the mandate of the mask in public will go off. So this is aimed specifically at the 7 counties where we are the most concerned. It does not mean that people should not wear a mask, or we wouldn't ask them to wear a mask in public in every other county. We really do. We think it's a good way for your county not to get into that red category. But it is only going to be required in those 7 counties. Let me just highlight a little bit of this. In these red counties, people will need to wear a mask in the following circumstances: when they're in any indoor location that is not a residence, when they are outdoors and unable to consistently maintain a distance of 6 feet or more from individuals who are not members of their household, or while they are waiting for or riding, driving, or operating public transportation, a taxi, a private car service, or a ride-sharing vehicle. So that's the essence of the order. This order does not apply to children under the age of 10 or any other minor who cannot safely wear a face covering, or anyone who cannot safely wear a face covering. The order also reflects the mask guidance that has existed for employees and businesses under the health and safety guidelines, which does not require a person to wear a mask if their physician advises against it, if wearing a mask is prohibited by federal regulations, if communicating with the hearing if they are communicating with the hearing impaired, when alone in your own office or your personal workspace, or other similar measures. So we're going to basically follow the exceptions that have already been in existence for some time in regard to the requirement that people wear a mask while at work. So we're basically extending that order now for the red counties and for individuals who are out in public.